Magandang umaga po sa ating lahat. Natutuwa po kami ni Ayen na kasama kayo ngayon sa ating pangalawang Program Partners Conference. And we hope that you will find this truly fruitful activity for you not to spend in the next 3 days. We hope that you will stay with us up to May 14. So my task this morning is to share with you the status report of Vitamin Angels in the Philippines. So for those of you who are joining us for the first time or have met us for the first time, I'd like to give a short background on Vitamin Angels. Vitamin Angels is a global public health nutrition organization that seeks to promote health and economic equity across the lifespan by ensuring nutritionally vulnerable underserved populations have access to evidence-based nutrition interventions. Now, what are those evidence-based nutrition interventions? These are the multiple micronutrient supplementation for pregnant women, or we call it MMS, vitamin A supplementation and deworming, or VAS plus D, and an intervention that is in development right now is maternal and child nutrition education and behavior change. We also have supplementary feeding, which is focused mostly in the US and the UK. So how do we do this? We reach underserved women and children during the first 2,000 days, which is the period of life from conception up to the time that the child is 5 years old, by partnering with governments, non-government organizations, academia, and private sector. So through these key activities, we are able to partner with those different organizations and agencies. So we provide advocacy and advisory services to create an enabling environment to introduce and implement evidence-based nutrition interventions. We also provide technical assistance to ensure effective delivery of this evidence-based nutrition interventions, primarily through learning solutions, monitoring and evaluation, and implementation research. Now, where gaps in coverage persist, we provide resources, particularly gifts in kind, commodities for the vitamin A supplementation, deworming, and MMS programs. Globally, in 2019, we were able to deliver evidence-based nutrition interventions to 70 million hard-to-reach women and children in over 70 countries. A little more, almost half of this reach occurs in the 9 priority countries, of which the Philippines is included. And this was done through over 2,000 partners. Now in the Philippines, through your partnership, this is what we were able to accomplish in the year 2020. We continue to coordinate and meet with the DOH, particularly for the MMS programs, but also for the vitamin A supplementation and deworming programs. But last year, there was considerable discussions on how we can support the Department of Health to introduce MMS for pregnant women on a wider scale. We provided technical assistance through learning solutions. When a partner receives a grant, we ask them to select a training option from the training toolbox that we email them. Currently, we have courses on vitamin A supplementation and deworming that occur using 2 platforms, the instructor-led skills development course and e-learning. And we know also that because face-to-face interaction was limited last year and still continues to be limited, many of the program partners opted to take up e-learning. Similarly, we were able to conduct the webinar on the safe delivery of vitamin A supplementation during COVID-19 pandemic. And many of you actually, I know, participated in that webinar. We provide support tools to our partners, specifically their service providers, to guide them in the provision of the vitamin A supplementation and deworming. We also have some educational materials for both the beneficiaries and the service providers. Technical assistance or monitoring was also done last year. We were fortunate to have visited 3 program partners before the lockdown. Through the monitoring visits, we were able to collect data that helps support programmatic decision making and also helps to determine and validate the extent to which our mission is being achieved. During the monitoring visit, we were able to observe our program partners provide vitamin A supplementation and MMS for pregnant women. We were able to assess whether these interventions were being done according to best practices and if the program partner was reaching underserved and nutritionally vulnerable children and women with these interventions. We also were able to observe whether they were having appropriate inventory management and record keeping. Another key activity is the provision of resources to increase availability of evidence-based nutrition interventions to women and children. In 2020, we're happy to share that we're able to mobilize 42 program partners. Of these 42, 45% were non-government organizations and 29% were from the local government unit. Most were at the municipal level, although we did have some provincial health office partners also. A little more than a fourth or a quarter were also non-government organizations that passed on or provided the commodities to local government units, particularly municipal health offices. So we call this the pass-through model. This chart shows the trend of increase of program partners mobilized through the years. So we are very happy that over time, more and more program partners are accessing the support that we provide. These are the number of children under 5 years old that were supported or reached with vitamin A supplementation and deworming, as well as the number of pregnant women that received the MMS. This number of women is actually 30% more than the target number that we had planned to reach in 2020. And this is probably because also of the increased need due to the lack of access to nutritional food and other food sources, due to the restrictions imposed secondary to the pandemic. This chart shows the trend of beneficiaries reached from 2017 to 2020. In 2017, the number of children aged 6 to 11 months reached or given vitamin A 100,000 IU was really quite a lot, because the size of the grants was really quite big at that time, even if the organizations or the program partners were fewer at that time. And as we were able to engage more program partners, their grants were focused more on the older children, the 12 to 59 months old, which actually required the 200,000 IU. For albendazole, the trend of the reach is increasing from 2018 onwards. This is because our program partners had feeding programs that required or that were complemented by the deworming. For the MMS, the number of pregnant women reached with MMS, there's really an upward trend because over time there was increasing supply also on our end as well as growing demand. We were able to engage more organizations that were providing maternal health and nutrition services. So in terms of location, in 2020, we were able to reach 46 provinces and 8 cities for all programs, vitamin A supplementation, deworming, and MMS. So just a note, now if the 46 provinces does not mean the entire province. Although we had several provinces that really were covered with these with the support with these evidence-based nutrition interventions. But many of these are all at the municipal level. So we still covered or we still indicated in the map because it was easier to highlight a province. But for example, like Palawan, we're really supporting the entire province of Palawan. So 19 out of the 36 focus provinces of the Philippine Plan of Action for Nutrition are included in these 46 provinces. So we're happy that somehow we're able to support the focus areas of the Department of Health. And we hope to be able to fine-tune the focusing of these areas in the coming years. We know that 2020 was really a challenging year for us. And in the Philippines, we are affected not just by the pandemic, but so in conclusion, we'd like to share with you the main highlights of 2020. We know that last year was truly a challenging year for many, if not all of us. In the Philippines, we are affected not just by the COVID-19 pandemic, but also by several natural disasters. But we are very happy and thankful that we were able to continue supporting uh, your focus communities, the communities in need during the pandemic. Last year also, we were able to engage more local government units, and we are happy that we were able to fill in the gaps. We were also able to mobilize new program partners, and several program partners that were already in active or lapsed also renewed their grants. And one really good news that we want to share with you is that we are now officially SEC registered as a local representative of a foreign nonprofit. So this process started last quarter of last year, and finally early this year, actually I think last month lang, we were able to secure our SEC certificate. So moving forward, we intend to continue support for our program partners during and even beyond the pandemic. Through our key activities, we hope to be able to find more ways to support you. We also aim to develop innovative ways to conduct these activities. One initiative that we will be doing in May actually is a remote monitoring, and we hope to be able to conduct more webinars and other activities that you may want to suggest also. We also intend to support the DOH plan to introduce MMS on a nationwide scale, and we intend to develop more educational materials to meet your needs. So with that, I want to end with a quote from a famous and very kind-hearted woman, Mother Teresa. None of us, including me, ever do great things, but we can all do small things with great love. And together, we can do something wonderful. And that is true for us in Vitamin Angels, and it's all because of you, our program partners. We are very thankful that through your partnership, we are able to do a lot. It's true that no one can really do anything significant on our own or anything meaningful, no? But together, with our efforts and energies and resources and our good intentions, when we bring them together, then we are able to reach more Filipino women and children so that we can build a healthier nation. So with that, I'd like to thank you for your kind attention. Thank you for listening to the presentation. And we hope that you will stick around for the rest of the morning, for the other sessions, as well as for the other sessions on Thursday and Friday. Maraming salamat po at mabuhay tayong lahat.